Broadcasting from Salisbury University campus, this is WSDL Ocean City, NPR News Talk 90.7, putting Delmarva first. Stay tuned for Delmarva Today with your host, Don Rush.
This week, President Trump addressed the nation as the country braces for the spread of the coronavirus, which has already topped 1,000 cases. Welcome to Delmarva Today. This is Don Rush. Even with promises of more test kits, local and state governments are scrambling to meet the challenge. There have been a number of cases in Maryland as the governor announces new emergency measures. Meanwhile, Wicomico County health officials are putting in place measures to control the disease. And on the hospital side, the Peninsula Regional Medical Center is gearing up to handle an outbreak. With us in the studio this morning, Dr. Charles Silvia. He's the Chief Medical Officer for the Peninsula Regional Medical Center. And Olivia Butler. She's the Programming Manager for Communicable Disease. And welcome to the program.
Thank you.
Thank you.
So, Olivia, I want to start with you. How serious at this point is the disease in Wicomico County in specifics as well as Maryland in general? We've had obviously a number of cases, but I don't think I've spotted anything yet on the Eastern Shore. What are we looking at?
Yeah, we haven't seen any cases here yet on the Eastern Shore, but we are doing our very best to monitor and evaluate people that may have symptoms that suggest possible infection. We're reviewing all of those and talking with the state about them and trying to get testing done if it's warranted for those. So we are working very hard with the hospital and local providers to do that.
In terms of testing, is there has any testing been done? And I understand that tests are at the state level. What's going on with that?
There have been tests that we have sent out, and some of those are still pending, and some we have had results back that are negative.
Mm-hmm. And how does one get a test? I mean, what's the criteria?
Well, they would have to talk with their provider. If somebody is sick, it's suggested that they call ahead to let them know what's going on with them so they can get instructions on what to do when they come to the office. Or if they end up in the ER or an urgent care center, their symptoms are evaluated. We look at certain risk factors, like if they've traveled or been around large groups where we've identified cases in the United States. We rule out other illnesses like flu, and then if they meet those criteria, then they could possibly get tested.
So in terms of symptoms, what are we looking at, and how does one distinguish between, say, the virus itself and, say, a cold or even a flu? I mean, how does one know the difference?
Well, they are very similar symptoms. The main symptoms we're looking at with this are fever, shortness of breath, and cough. Now, that's not to say somebody might have others or may not have some of those, so it's really important that they're evaluated and other things are ruled out too, because we are still seeing some flu in the community, so that would be one of the first things that they should try to rule out.
How, if someone has some of these symptoms, what's a tipping point for them saying, I got to go in and check it out, or do we really know?
Well,
Go ahead.
what I would recommend is if it's just fever and cough, sneezing, that sort of thing, you stay home. Mm-hmm. If you have significant trouble with your breathing, that's when we start to get worried, and that's when you should be, come to the doctor and get checked out more aggressively. Is
there any real treatment for this, or is it just simply palliative?
Well, it's not palliative, but but it's supportive. If we have medications that help breathing, we have oxygen, and in the worst case, ventilator support until the person can rid themselves of the virus.
And what populations are we looking at in terms of who might be most vulnerable? Olivia?
Well, what we have seen when we've looked at cases that have occurred in other parts of the world, the people that are getting sick and getting more severe symptoms of it are the elderly and people that have underlying medical conditions that they're normally at greater risk for things anyway. It is still affecting some of the other ages, but they're not getting as sick.
And when I was reading about that, one of the things that struck me is that we have retirement homes, we have nursing homes, a number of them. What kind of coordination is being taken there? What kind of preparations just to make sure that this doesn't spread amongst their population?
Right. I know that locally the nursing homes for the last few weeks have been looking at what they plan to do to prevent any infection in their facilities. And I know this week a lot of them have put into place visitor restrictions or going down to no visitation to kind of prevent that. If they do have visitors come in, it's limited. They're screening them upon entry to the facility. I know some of them have put into place things like Skype or FaceTime, so family can still interact with their family members that are in there, but not come in and expose them.
So, Dr. Silvia, we've talked a lot about social distancing. Mm-hmm. How should people change their habits?
Well, again, it's spread by contact or in the air when you cough or sneeze. So the more we can stay away from large crowds, the more we can stay at least 6 feet away from each other, avoid people that are sick. They're obviously sick, coughing, and just try to stay away from people in general. It's very hard to do. People have to live and work and go to the grocery store and all that, but we're really trying to limit it as much as possible. And if you do start feeling sick, you really got to triple your effort to stay away from others, including your family, as best you can, especially if you have elderly relatives, because like she says, that they are very vulnerable. Over 60 and other comorbid problems is really scary.
Well, why is it that the elderly are more susceptible?
We don't really know for sure yet, but their immune systems are typically weaker. And there's a lot of research going on with this. Again, this is a new thing for us in general. And a lot of the research so far has been in foreign countries, not in the United States. We've just had this in the last couple of weeks. So we don't know for sure. But again, elderly are usually the most vulnerable, for anything that we get. So if your immune system's weaker, if you're ill with diabetes or COPD or heart disease, those kind of things, it puts you in a weakened state, and you're just more vulnerable.
In terms, by the way, Olivia, in terms of the state, obviously there's declaration of emergency. There have been cases in Maryland. What kind of coordination is there with state government? And what are there things that you're hoping to get from the state government outside of obviously the testing that they're going to do? I mean, what's kind of coordination is it at this point? Discussions?
Well, I mean, there is a lot of coordination between us, the state health department, our health officer, and people within the government. And we've tried to be, I guess, as best as we can, working with everybody. We've had some meetings with other agencies and county, city government to try to figure out, what their plans are. Do they have needs that they have if they maybe don't have the workforce, or just to start thinking about what they're going to do, because now we have schools that are closed, so people need to have plans in place on what they're going to do with their children so that they can continue to work, or if there's jobs where they're able to work from home. We've been doing that over the past week or two, trying to get these places out in the community to think about what they're going to do. We are in communication almost daily with somebody from the state health department for whatever, and then they have frequent calls that they're doing updates with us. So there's a lot of communication and coordination going on between us, the state, city, county.
Is there any expectation to be any kind of limitation in number of people can gather in any given place, or what you're thinking at this point?
Well, I think now what they're saying is that large gatherings over 250 people should be stopped for right now. And then other gatherings, I think they're just looking at, if you don't need to gather, you probably shouldn't. And if there are gatherings, then, those people that are at increased risk probably really should consider not going to them. The elderly, the ones with underlying medical conditions. If, there's still things that are going on and we haven't really put a restriction on everything, those people still need to be cognizant of what's going on in the community and try to protect themselves.
So, Dr. Silvia, I guess one of the other questions is obviously if this thing does pick up speed, the hospitals are going to be sort of on the front line. I was looking at some statistics. There's something like 160,000 available ventilators, I guess, in the country, kept by hospitals and the government. Some 45,000 ICU beds in the nation. A moderate outbreak, though, could say 200,000 might need those kinds of beds. You're at a hospital. It's a fairly small population. What do you think when you look at those statistics, at those numbers, and how is the hospital trying to prepare for it?
It's a challenge. We have been planning for this. We've been working as hard as we can with the health department and others. It all depends on volume. It's about how many patients do we get at one time. There is a limit to no matter how much support you have, no matter how much resources. But we are getting as ready for the challenge as we can. In a disaster, usually you have others that can come and help you. In this situation, the rest of the country is in the same situation as we are. We have enough ventilators at present. We have extra, but we also take care of people every day normally. And a lot of times our beds are half full or even more than half full. So but we can expand, and we have to, again, keep people out of the hospital as best we can. At some point, if we see the volume start to increase, we may stop elective surgeries and things to be able to free up beds for us. But we will see. I mean, it all depends on the volume, but we're all of our people at the hospital, and I think the health department are all here for our community like we've always been, and we are going to take care of it as best we can.
And you have, I guess, what they call, the negative pressure isolation rooms. What are those, and how many do you have?
We have at least 20. They have some that we can expand in the emergency room as well. What they do is they basically pull the air out of the room to ventilate the room so that the air circulates to try to, if there is any virus in the air, to kind of get rid of it rather than it sitting there. We have enough for normal and then some activities, but we will see when we run out of those beds. We'll use other beds. We'll just keep going until we take care of everybody.
By the way, have you been in touch with or been trying to coordinate with other hospitals in the region? I mean, because obviously, for instance, if you're hit with more patients than, for instance, you can handle, is there the ability to send it to other places?
Normally we do have ability to send patients that we can't care for or others can't care for. They send to us. So that system is in place and has always been in place. Like I said before, it may be that there may not be room at other places because they're full too. We'll just work together as we always do. But again, there is a limit.
And what about the staff? I mean, and what kind of training is there? What kind of protective gear will it be dealing with? I mean, they're the people on the front lines.
The fortunate thing is that we have had drills, you've heard of Ebola, years ago, where we set up a system where we train for this sort of thing. And Corona is not Ebola, but the same ideas of using the protective gear and the processes that we do to protect ourselves and others are there. So, we're ready. We know how to do it. Our nurses and doctors know how to manage, this type of infectious process.
Because, matter of fact, I read it, some hospitals are sort of trying to establish a series of tiers in which, they're in one tier, there'll be, ICU, which with people, real serious patients, then down and so on. Are you doing something similar or?
Right. Well, we're in the process of getting a tent, which a lot of the hospitals have. They put a tent outside of the emergency room as the first line of triage, because we don't want the virus in our building if we can help it, especially if we don't know it's there and can spread before we know. So that's in the works to be able to screen people there. I say most of the time, most people go home. When they're screened. Now, we may send off a test, but we say, okay, the test will come back when we get it. It may be a day or two. but go home and we'll let you know, because again, the gigantic majority of people won't be sick enough to be in a hospital. But we'll have to monitor. They'll have to self-monitor to see if things get worse or not. Our testing is really what we want to do. We need to have testing where we can test somebody just like we do the flu in the hospital and the offices, and know right away that do you have it or not. And that's a work in progress as well.
Will you be able to do testing to the hospital, or are you going to need to send it out of the state?
We are trying our darndest to be able to get the materials and the test kits to be able to do it ourselves. Again, everything so far has had to be sent and has to be screened. So, again, we have to have permission to be able to send the test. We can't say, to send them all, because it will overwhelm the system that is currently there. The system is gearing up, but it is taking time, and but we do need to know, because it's uncomfortable to see somebody and say, okay, we'll test you and we'll get back to you, and they go home and what do I do? If we could tell them you got it or you don't, because isolation is a problem. People have to live, and if you don't have it, we wouldn't have you sit for 14 days cooped up, and that's a big disruption in everybody's life. So we'd like to know, and if you do have it, we really like to know that, so that we can be prepared that if you do get sicker. So that is a work in progress. Again, our country's behind on this. We're trying to catch up, but we're doing the best we can.
What about in terms of cost? In fact, there was an issue on Capitol Hill yesterday. Right. I think one congressional member said something that could be $1,000. I don't know whether or not. What does that mean in terms of the person who's coming in, and maybe they might not have insurance? They might say, "Well, I can't afford this, so I don't want it." I mean, how do you deal with that? Are you just going to test everybody? And
we deal with it like we do every day. You come to the emergency room, we will treat you, no matter if you have insurance, money, whatever. That's not the problem right now. We got to take care of our people, and help them not spread it to others. So we'll worry about that later. But we see people. You don't have to, pay before you're seen in the emergency room. We see you, and say that's not our issue right now. We shouldn't be thinking about that. We should be thinking about taking care of our community.
You think that anybody comes in that they, if they don't have insurance or something, that
we still
shouldn't have to pay, and they shouldn't have to. Do you think they should have to pay for it?
Again, we'll deal with that later. But like I say, and the hope is that the government will be able to support our needs for that. But again, it's about people, not about money right now.
So how does this compare to other outbreaks of viruses?
Well, everyone's unique, I guess, and again, we've had experience just in a few months in the world. This hasn't been the fifth time we've seen this, so we are learning. We are learning on the fly, and we're learning from other countries. But the United States is the United States, and again, we don't have that many cases, thank goodness, yet. But we're learning from each one, and all that information is being, forwarded to everybody. We get stuff constantly, and that's part of the frustration, is because what we tell you right this minute, tonight may be different, because we'll have more information. But I will commend the governor in the state of Maryland in being very aggressive. A lot of people may say, "Oh, we're overreacting." You get one chance at this. If you don't put into place the things that we're doing now, we will suffer later. So it could be an inconvenience for people, and hopefully it turns out that it's not so bad in Maryland. But we are trying our darndest to make sure that's happening, and not wait and see, because when you wait and see and it starts really gearing up here, it's too late. So again, We need everybody's help.
How does this compare to, well, either H1N1, but, a lot of people are aware of the 1918 influenza,
Right.
which had, I think, about 2% death rate is what the estimate was. How do you compare this, from what we know right now, because we don't know a lot, with, say, those kinds of outbreaks?
Well, again, there's different estimates on the fatality rate for the COVID-19. The regular flu that we're dealing with today, and there is quite a bit of flu still in our community. It's about 0.1% mortality rate. Dr. Fauci on TV's, just today said, maybe it's 10 times that. We don't know. We're thinking it could be 2 to 5%. Part of our problem is, again, we're using statistics from other parts of the world. If you don't test, you don't know how many people have it. We know how many people die of it, how many people get hospitalized, but people out in the community, a lot of people are going to have it and never know they had it because it could just be a mild illness. So you don't know the denominator as accurately as that we would like as far as how many people have it and then how many die of it, and that's what your percentage comes from, right?
Right.
So we just don't know that denominator accurately yet. Down the road we'll know, but right now we do feel like it's a lot worse than the flu, and again, with no specific treatment to fight it, that's a problem.
What kind of risk is there of getting it? We've been told that it's low, but some people have said that a few weeks ago before a lot of other
right.
These. I mean, either one of you. I mean, is it low? I mean, what do you think, Olivia?
Well, again, it's all about exposure. How many people that have you come in contact with that have the virus, whether you know it or not? How many surfaces have you touched that had the virus on it? I saw just recently that the virus apparently in hard surface can live for 3 days. So you could have touched a doorknob from somebody that walked into the room an hour ago and touched it, and then touch your face, touch your mouth, your eyes, and get it that way, and had no clue that there was anybody sick around you. So again, that's where we have to be very careful. We have to clean surfaces, especially surfaces that are used like doorknobs or handles and chair arms and all those things that people touch a lot. Wash your hands constantly. Don't touch your face, which try not to touch your face. It's very hard, but try not to touch your face. And cover your nose and mouth when you sneeze and cough. Don't do it in your hands. Do it in tissues or in your elbow to try to, and then wash your hands. All those things make a big difference, and really that's what we got to have our people do.
One other final question. So the issue of masks, how effective are they? What kind of masks should people be thinking about if they think about them at all?
Yeah.
Well, it's not really recommended for someone to wear a mask if they're not having symptoms. They probably will be asked to put on like a procedural type mask if they're coming into an office with symptoms, and they have decreased some of the guidance for what types of masks are needed by healthcare workers if they're collecting specimens to be sent off for testing or doing procedures that might cause aerosolization of the virus, from N95 masks that are fitted to procedural masks. And that is, they would wear the N95s if they were doing those procedures, but just in general care of the patient, being in the same room, the procedural mask would be fine. And that's to kind of help the supply of the N95s, which a lot of places, if they didn't have any, are having a hard time ordering them and saving those resources for when they're truly needed.
And the N95, they're described as respirator masks. What's that mean? What do they look like?
It's just the way the mask is made. It's much more, we'll say, powerful on its preventing particles from getting into you, as opposed to, like she says, a procedural mask, the cone mask, or the mask you see that tie. It's all about blockage of transmission. So again, people that have the virus, or we think they have the virus, we put a mask on to try to prevent them from spreading it to others. The people that are taken care of, people with known corona, that they wear masks. The general population is not needed.
We'll be speaking with Dr. Charles Silvia. He's a Chief Medical Officer for Peninsula Regional Medical Center. Also, Olivia Butler. She's a Program Manager for Communicable Diseases and here in Wicomico County Health Department. Appreciate you both stopping by and chatting with us.
Thank you.
This has been Delmarva Today. I'm Don Rush. Thanks for listening.
Thank you for watching Delmarva Today, a production of Delmarva Public Radio. Production and audio engineering by Chris Rank. Hosted by Don Rush. For podcasts, visit delmarvapublicradio.net or subscribe to the Delmarva Today podcast on iTunes. You can also watch Delmarva Today on PAC 14 by tuning into Comcast Channel 14 or youtube.com/PAC 14.